meeting is going to be focused on QHP quality. Dental carriers, feel free to drop. And we'll go ahead now and take roll. Is anyone here from CHPW?
Yes, I was just looking to see if anyone else was here except me, but we will have our quality team on if they're not already on. Thanks.
Great, thank you. Coordinated care.
We are on.
Great, thanks, Isabel. Kaiser Permanente.
Greetings, Kaiser's on.
Thank you. Melina.
Hello, Melina's on.
Excellent. Primera LifeWise.
Hi.
Primera's on.
Here.
Great. Regents Bridgespan.
We're on.
Kristen, we're here.
Excellent. United Oregon.
United is here.
We're on.
Great. And WellPoint.
WellPoint's here.
Excellent. Okay, and then just checking quickly. Anyone from AWIP here today? AHIP? OIC? Or HCA?
Hi, Carla Cowan is here from HCA.
Awesome, thank you.
Here as well.
Excellent.
And this is Sophia Pastro. I'm here for the OIC.
Oh, well, welcome. Thank you so much. All right, I will go ahead and turn it over to Leah Hull-Marshall to go through our introductory slides.
Great. Can we have the next slide, please? Sorry, I was trying to multitask and just let anybody that is from a dental carrier know they're very welcome, and we're going to be focused on health plans today in case they missed the intro. So this is our agenda today. I'm really going to go through the goals with you all and then turn it back over to Kristen for a little bit. Welcome questions along the way. And really, I don't know, I just wanted to say one, thank you to you all, and two, thank you to you, Kristen, and the team that's been working on these. It's nice to focus on something that I think we all care a lot about, and that, you know, we do want to make sure that we continue to pay attention to, so that as we try to address all of the other issues and concerns that are coming up that really are worrying us about people's ability to keep their coverage, we want to make sure that coverage is meaningful and leading to higher quality health outcomes. And I think you all share that. So I don't know, I just felt like this is a welcome respite as we began to plan for this, and really appreciate it. So with that, can I have the next slide, please? All right, just a level set for those of you that have been with us for multiple years. You'll recognize that this is the time of year that we take to engage on quality that that is outside of our certification process, and just talk about our framework, talk about where our progress has been, and discuss where we are thinking about maybe future areas of focus and get feedback. This is not the only opportunity for you to get feedback. It's really just one along the way. So next slide, please. Okay. These are not quite final. You'll see that they're draft. They're strategic priorities of the exchange from the leadership team, including myself. We set these based on first looking at our board's strategic plan. They just met at their summer retreat to refresh it. And so then we look to align these strategic priorities to that. So that'll be happening in this next month, but here they are in draft form. And I think a couple of things that I would call out for folks here is that hopefully these aren't new. They've been slightly refreshed, but one of the things that we've been thinking of in terms of where we are organizationally and what we're facing in the marketplace is, do we have the right priorities? And And these are the ones that we think are the right priorities. The two that have some stars on them are in the boxes, and then the equity and mission are ones that also align with and inform our quality program. So supporting our customers, positioning for the future are ones that really align very well. Talk a little bit about that, as well as what underpins all of our strategic priorities, which is a focus on equity, and what overlays all of our priorities, which is our mission to help reduce the uninsured to less than 3% in Washington and radically improve how people access their healthcare. Next slide. So starting with that in mind, looking at the quality programs goals that we have had, I'm not going to read all of these for you, but as we take from our organizational goals and think about how the program can help support them, these are the areas that we seek to advance within the quality program. Next slide. This is one of my last slides. So in order to do that, we have identified areas of focus, and we've really tried to be strong in being consistent about our areas of focus so that, as we measure over time and as we have these discussions, we're not kind of pinballing around to the latest issue. It doesn't mean we don't want to make adjustments as are necessary, but really we see these as foundational guidance for us in helping to get to the goals that you see in the previous slide. So there are 5 here, and they remain our areas of focus. I think where you see change and where we start to think further about what to do in the upcoming year is what are the next steps, or are there places we need to adjust or pivot to in the either the guidance that we're providing, the metrics we're collecting, or our quality improvement action items. So I think you'll continue to see that these are, broadly speaking, our areas of focus, or where we think the right areas of focus remain. Next slide. All right, I think this one I'll turn over to you, Kristen, or is this one I was supposed to complete?
I can take it from here. Thank you so much, Leah.
Thank you. I
And-
appreciate it.
Good afternoon, all. Kristen Vies, Senior Policy Analyst, and I manage the Exchange's quality program as one of the hats I wear. And as Leah discussed, this meeting is an opportunity for us just to conceptually give you insights into what we're thinking about for the future of the quality program. And we're already thinking about 2027, as hard as that is, given all of the other challenges in our environment. And so we have a couple of quality focused meetings every year at the Exchange. So there's this summer one to talk on a more conceptual level. And then in November, we share analysis so you can see how different carriers are doing on their QRS and QIS results. And just this is a good kind of reminder that our quality program here at the Exchange builds on baselines for the federal requirements. And so recognizing that you may work on quality efforts for multiple lines of business at your organization, if you would like a review of those specific components required by CMS for the Exchange, we did put those in the appendix. But we wanted to share here some specific examples of how the Exchange builds on those federal requirements. A big one is that we have our carriers participate in the quality program from the start. So before their first open enrollment, we have them submit a quality improvement strategy. And this is really about them submitting some goals for key metrics. Then we have carriers focus on at least 2 measures in their quality work. And one of them is an Exchange required one, which is the cervical cancer screening. And then the carriers are welcome to choose any other ones, and they can certainly choose, more than 2. And so for the required measure, we set performance standards, and then we require stratification by some key demographics. So results from rural versus urban members, and then also customer race and ethnicity, so that we can see how things like cancer screening rates are looking by subpopulation. And this is really supported by what has been a multi-year effort with all of us, where you are reporting race and ethnicity on more and more of your customers, with the goal here of having complete enough data to identify what populations need more support. And then this is also, rounded out by data collection efforts that we have been working on with brokers. And then, of course, we have a number of metrics and goals around primary care. We have carriers report on, and we've taken these from state leaders. So things like the Healthcare Cost Transparency Board and BRIE Collaborative. And while we've built out some additional reporting requirements and operational expectations, so a good example of that is the requirement that customers without a primary care provider eventually are auto-assigned one. So just wanted to give you that overview, and we can move to the next slide. So thinking back to those focus areas Leah shared, here are some more specific thoughts about how we might grow and develop in these focus areas and some future tactics. So one is already in our guidance for participation for 2026, and that is beginning with plan year 2027. Carriers will need to have a contract mechanism in place for brokers to collect race and ethnicity data collection. As we've shared in a few quality meetings, we have seen this multi-year trend where customers who are paired with brokers are less likely to answer these questions on their application than if they shop with a navigator or if they shop by themselves. And then thinking about primary care and access, to these core services, what we have seen a few years in a row is that our health plans have scored low on that CMS access to care measure relative to other exchange plans in other states. And so we did take a look at some of the, OIC network access reports. And what we learned is that there's a wide variety in how carriers are monitoring timeliness and access to care. And so that prompted us, as you know, to ask some more in-depth questions on the QIS this year, because we want to see what specifically are you tracking. And then we found some metrics some carriers are using that we thought would be really good ones to track. And so before, adding on any more requirements or tracking, we just wanted to get a sense of feasibility for those. And then behavioral health, of course, remains a big focus for both us here at the exchange and then us as a state. And so up until this year, antidepressant medication management was a required measure on the QIS. But as NCQA is retiring this, we're kind of waiting and seeing what we can learn from outcome measures. So now the QRS has that depression screening and follow-up measure. And again, we just want to wait and kind of get a sense of where carriers are at on this measure before we make any new requirements in this area, since it is a transition time. And then finally, we did make the decision, which we explained in the 2026 guidance for participation, but our quality standard is that QRS 75th percentile score. So we previously had been basing performance standards off of commercial benchmarks, but we opted to transition to the exchange ones. And to that end, we're always looking for any innovations we see from our carriers that we learn about from your QIS, and elsewhere in the market. So we are active participants in employer groups, such as the Purchaser Business Group on Health, and then also the Purchaser Affinity Group. And so we're always looking from things, even outside of the exchange, to learn about how might we drive quality improvement together. Next slide. So looking to the next, iteration of the quality program and the future, our focus is thinking about how can we, advance from the reporting and the analysis work we've been doing together to really impact the market shelf. And so the focus now is really on how can we improve our current metrics rather than just continuing, to add more to track. And then in our role as a market steward, we are thinking about what levers do we have, including ones we haven't used yet, to really incentivize quality improvement. And where carriers are already performing well, we want to incentivize that they sustain that great quality performance. And so we will share with you some things we're thinking about. And these were ones that we previewed with our board policy committee back in May. And really the message we heard from them is that, in this environment with all these federal challenges, like it's imperative that we don't forget about quality and that it matters, more than ever. Next slide. And so as we said, our standard is the QRS 75th percentile. And as we have, done analysis and tracked progress over the last several years when we do these annual quality reviews, we really see mixed results. So there has been some improvement, and for some metrics, carriers have met QIS targets and set new higher ones, which is great. But then unfortunately, in some cases, performance on the metrics stays very stagnant a few years in a row or even declines. And really, to us, this also shows that the importance of really needing that demographic data to better understand, those folks who were missing, who were having those care gaps. And so this graphic, this is from last year, but what it shows is how carriers' performance on last year's QRS compares to the commercial benchmarks. And so recognizing that we will be transitioning to the exchange QRS benchmarks, though the QRS ones tend to be lower than the commercial ones, we know that unfortunately we would still see carrier performance on many metrics to be in that red area below the 50th percentile. So kind of setting this up as, this is our problem statement, that there's a lot of areas that still need improvement. Next slide. Since 2022, our board strategic plan has directed the exchange to act as a market steward. And so one of the key duties our board has is to certify those plans for sale on the exchange. And there's a number of certification criteria, and a couple of those are specific to quality. And as you all know, only those plans the board certifies can be offered on the exchange. And so really the certification process is one opportunity where the board can really serve in that role as a market steward and what we're showing on the shelf for customers. And so before I worked in health policy, I worked on a buying team at Costco, which, as you know, especially those of you in the Northwest, Costco is really known for their quality products. And I think about how could we offer customers a similar experience here on the exchange. So where they have a handful of quality, trustworthy options, at good prices where they can make a confident choice. And so, of course, I recognize there's so much more at stake, and the decision making is a lot more complex than buying peanut butter at Costco. But kind of the North Star and the idea is thinking about like what kind of experience do we want folks to have when they go and they shop for coverage and use their coverage throughout the year. Next slide. So talking some more specifics. So these are some levers that we shared with our board back in the May Policy Committee. And so those items you see in bold are potential, but ones we haven't used yet to really drive quality improvement. And so recognizing we are not set up like an active purchaser, like Covered California, for example, we still have many other opportunities. And so at this stage, we just want to introduce these ideas. So this, first bucket of things we're already doing. We share with our board where carriers are at in meeting quality program requirements. So those targets for the required measures, and then also carrier progress on race and ethnicity data completeness. And then we also have language in the guidance that we could, if we thought it was warranted, have carriers present to the board if we see that there's consistently, poor quality performance. And then with the setting standards lever, we have set quality targets for our required measures, and we gave carriers a few years to work towards these. And something we haven't used yet, but we could also think about is setting a performance floor, is that is something Covered California has done for some of their select QRS metrics. And then really thinking about the customer and how might we, nudge them in different directions. So we launched a new plan recommendation tool on Health Plan Finder this summer. It is still called Smart Plan Finder, but we are working with a new vendor called Consumer Checkbook. And it takes into account the carrier quality performance in its recommendation. It's a small portion, but it is part of the scoring. And there's more we could do here to nudge customers in terms of our display order. And from CMS, there's more flexibility in terms of other visual indicators we give to customers about plans. Then thinking about financial incentives, this is a place we could do more. So one spot is looking at the carrier assessment and how we calculate that. So thinking about how might we incorporate plan quality as a factor in that. Another place, and this is one that shouldn't come as a surprise, and we all stakeholdered with you last fall in our draft 2026 Cascade Care Savings Policy Concepts, but making quality in some way a part of Cascade Care Savings in terms of either, which plans are eligible or the amount of Cascade Care Savings. And so we did share, some specific concrete examples in that draft policy, and we got some really helpful feedback from you all. And while we opted to not move forward with any changes there for 2026, this is an area where we remain interested. And finally, at the highest level is really about participation in the marketplace. The board could, choose to decertify a carrier if for several years, we see that there has been poor quality of performance and there's not any indicators of improvement happening after several years. And relatedly is, looking at expansion. So that could be either for any health plan wanting to expand into a new market or through public option contracts. So perhaps making the ability to expand into new counties with public option contingent upon quality performance in some way. I know that was a lot, so I'm going to pause here and see if there's any reactions or questions.
Kristen, I'll just add that I thought it was really helpful for us to be thinking about these in, kind of this overall, uh, where would we like to, where do we think the biggest area? Is it in transparency or is it in consumer nudging, for example, gets better outcomes and moves us along that quality spectrum? So I really appreciated seeing some different approaches and really was also thinking about that. So thank you for laying it out that way.
Thanks, Leah. And I think I saw Zandria had their hand up.
Yeah, thank you. I think this is also a really helpful way to frame this. And I wonder what the conversation has been or how you guys have grappled with the intersection of consumer price sensitivity as being one of the biggest drivers and how that connects to the, the quality outcomes that a plan is able to choose depending on what members can afford and what folks can afford. And as we potentially see it get more challenging to afford healthcare in the future in our environment. And I look at these options, I just wouldn't want to risk eliminating that biggest thing that we know is most important to our consumers. And how do we balance the quality? Because people do have choice. And I think where people can afford, they might afford certain plans that have more benefits and it might attract a certain person in our community who has a certain level of health at a baseline. So kind of how do we grapple with that as we consider these options?
Yeah, I mean, that is certainly a challenge and a dynamic that you're dealing with. Because you're right. I mean, some customers, it really is like what premium can I afford? Um, and so thinking about, for example, are there things that we can do in a responsible, thoughtful way with Cascade Care Savings, as an example. But like we of course remain like very cognizant of the price sensitivity. Thank you for that. And I think I saw John Pierre. John Pierre's hand went up.
Zandria, can I
Yep.
just hop in? Just if you have any either suggestions about how to balance those, because today we are talking about quality rather than affordability or access, but they all go together and we certainly recognize that. Happy to, or like how you all think about it as an organization, happy to hear that. And the other thing that it just brought to mind, and so wondering if there's within these tools, is there a stratification that you were thinking about or that you would like us to think about, maybe based on a carrier's risk score or something like that? Because I heard a couple of concepts, but I heard that as one that, yes, these are all carriers within a marketplace being, and we're looking at the same metrics, but the underlying population may not be the same.
Yeah, I was really thinking like how could we use the rich data that the exchange does have to understand the demographic differences when we're comparing the plans and somehow, yeah, factor that into decision making, especially if we're going to start, moving towards the more restrictive end of participation and financial incentives, because I think we might, reduce the number of plans and then those patients move to other options or maybe drop off the marketplace entirely. But, then we'd see likely other plans performance drop as those patients move and select another plan potentially, right? So just trying to understand, like, is it the plan that's delivering the outcomes or is it the population and where do we see plans serving the same populations but with differentiated quality performance and how would we adjust for that? I don't have a magic answer, but I just know that it's one of the things that we should think about for sure.
Yeah, I appreciate that. Thank you. Sorry to interrupt, Kristen.
Yeah, I again, thank you for that. And I would say too, Leah, I know this has been very much, in progress work. But we have been working with some folks at UCLA to do some preliminary risk scoring analysis. And we have even seen, because we do look at carrier financial data and things like the risk adjustment payments each year, and we have seen changes in the marketplace. So you're right. It is important to think about differences, in population. So thank you for that, important consideration. John Pierre.
Really appreciate the rich conversation going on here. One of the things that comes to mind is I'm thinking about the perception aspects of what customers think when they envision quality. What does that mean to them? Does that mean this is a health plan where if I'm sick, they'll make me healthier or it will keep me healthy? Um, those kind of things come into mind because it stratifies against each person's own health needs, right? That's a very different question for somebody who is healthy and is primarily focused on prevention, or somebody who is navigating and managing several chronic diseases, what quality means to them. So I'm very interested in customer research, perception research about how to communicate the value that quality can provide to these consumers in a way that is easily translatable to them.
Yeah, it's funny you mentioned that because this has, come up in a few different forums, in us when we meet with HCA and we talk about their experiences with state employees, and then I am on the CMS TEP where we talk about the QIS and QRS, and we also, chat a lot with Covered California, and I feel like this is one of those things where we all want to be able to do better of like explaining quality to people on the street. And we have, these like very specific measures from measure stewards. And it's like, how do we explain the results of these in a way that is relatable to people, in a way that they understand and makes sense? And I think that is something, you know, we could do better. And I think anyone offering health insurance, right? To better help customers understand. All right. Next slide. And this here, for those of you that want a different type of graphic, this is really taking the exact same concepts we had on the prior slide, and it's just visualizing them differently, really into buckets. And the intent here is so that you can see how these different, exchange authorities intersect with the quality program. And the italicizing is to indicate what might be some of those future opportunities. All right, next slide. So just to round out our conversation for today, we have a few questions here for your consideration for our discussion. And you're by no means limited to responding to these, but just some things to think about. We always like to hear from you what priorities you have for your quality program that you didn't see reflected here in our presentation. Then, to that point of learning from each other and innovation, what ideas for other levers do you have? And those could have come from other lines of business you've seen or from your participation in other exchange marketplaces. But ideas you have for other levers that we can consider to help incentivize quality performance. And then finally, we want to hear from you. So we're at this very early conceptual place for 2027. But as we start thinking about more specifics, what do you want us, the exchange, to consider and know from the carrier's perspective as we look to develop more specifically the 2027 quality program? Jack.
Hey, yeah. So, and not to back us up, but I think back 2 slides. Um, First of all, I'd say, like other carriers have expressed, thank you to the exchange for being transparent and socializing these ideas with us. It's extremely helpful, obviously, and appreciate the summer quality meeting. But I think if we went back a couple slides, and you don't have to do it literally, but uh, probably like other carriers, it makes us a little nervous with the idea of decertification, right? For carriers that may not be able to meet the exchange's ideas. Do you guys have a benchmark in mind, or a benchmark of metrics in mind for what you guys are thinking? I think once we get into the QRS, it's a complicated discussion, right, to be sure, because it's talking about data that goes back a couple of years, and it's a fairly convoluted formula to get there. And I agree with what other carriers have said, that not sure consumers exactly know what those quality metrics mean. I wondering about if you guys have benchmarks in mind that you guys are asking the carriers to achieve that would potentially put us in jeopardy of being decertified, or or what that further lever that you guys called it are going to pull is going to mean for us in reality.
Yeah, I would say that decertification is like the most, I guess, like the most like intense or extreme thing, right? That could happen. And no, we don't have specific like requirements or benchmarks. Um, but something like that, we would be looking at, like multi-years. And it wouldn't just be based on one measure. It would be like based on a number of things. And really also taking into account something like like, have we seen any improvement? But it would certainly be based on something holistic, and there would be a lot of like multi-year considerations. I don't know if you have anything else to add to that, Leah.
Well, I think
Uh,
that's what the conversation is about here is as we start to think about some of these others that we haven't used yet, what would be considerations and or appropriate benchmarks. We do have benchmarks currently that we have set for carriers to meet as Kristen noted, but I'm not sure that that would be appropriate necessarily for the certification conversation. The other thing that you mentioned, Zach, that I just want to make sure I understood, I think there was kind of two pieces. One was on kind of what might we use as metrics, and the other one was around do consumers understand? And I think what you meant is the star rating system and what's going into that. Is that right? Was I catching that correctly?
yeah, no, I was talking about the
Okay.
QRS star ratings for sure.
Yeah. And that, I mean, I think that's one of the things in that consumer nudging. Are there other ways that we might help highlight something? And John Pierre had a good point too, to add to yours around, is that the most meaningful, how that star rating system works versus is there something else we might want to look at? And are we considering what the consumer finds that value? So I think all those are good questions.
Okay, and thank you, to Kristen too. And I think just to clarify, so we're talking about what you guys are thinking about, anyways, is consideration on a carrier by carrier basis, looking at the history of their quality ratings, not necessarily setting a benchmark and saying if you don't meet this, you would risk decertification. It's more of a situational thing where you would say, all right, well, your carrier quality has grown over the years, and so this shows good progress or something like that. Or are you looking to set a benchmark by
I
which
think
that would
it's
be a
an
standard?
I think it's an open question at this point, whether if we were to move in that direction, would it be a universal threshold like the one that we've set for where we want to see progress on the metrics? Would it be some combination of time frame, progress, and threshold? Or I think what I heard earlier is taking into consideration something that might stratify carriers. And at least one of those criteria would be the risk profile of the customer base that that these metrics are then being applied to.
Okay, that's very helpful. Thank you, Leah. And it does sound granular, and so that would be based on uh, data that the exchange collects as far as quality in those different communities. I see you
Again,
nodding. Sounds like it.
early
Yeah.
stages, it might be. I don't know if there's a public source, depending on what we would be wanting to focus on, or we have access to the all payer claims database. Is there
Of course. Yeah.
administrative claim data that may be helpful for us there or not? I think those would be discussion points, and looking at, also wanting something that we haven't talked about here yet, but that is always kind of in our frame, and why we have folks like HCA participating, is that and that we participate in broader employer-based and other groups, is that to the extent that we're measuring the same, that should reduce some administrative burden and increase the ability for us to be focused in on maybe some core measures that are meaningful for all. And that, that's easy to say and hard to do, but I think it's always a consideration for us to try to make sure that we are aligning with community efforts. So where is it that we can align along those two?
Thanks for that, Leah and Zach. And I'm just here looking at the chat. So Krista shared that with some of the behavioral health metrics, you're really focused on depression response. And I mean, all this to say, yes, we agree that, outcomes measures are the most ideal ones. Currently in the QRS, as you know, they just added the depression screening and follow-up. Though we know there is the other DRRE measure, which I'm thinking that's probably the one that you're referring to. And as both of these measures are pretty new, and especially I think I've heard the DRRE is really a challenging one in terms of the data that's really needed there. We are interested in both of those measures, and we really want to give it a couple of years kind of to see where performance is as carriers and providers get used to those. And I saw a couple HCA colleagues joined, and I know these are also measures of interest to both of you. So, and for HCA specifically, so not sure if you had any thoughts there, since we have clinical folks on from HCA.
Kristen, is your question specifically around the depression screening and follow-up versus the response and remission?
Yes, yes.
Measures, yeah. I'm sure anyone who's on the call who has chatted with HCA in recent years knows that we are all in on outcomes measures. And Dr. Zersen-Thule, in addition to her interest and focus on primary care, is very interested in outcomes-based measures and DRE and specifically. So that is something that we continue to champion. And as you noted, Kristen, we know that there has been varying degrees of success in getting those PHQ-9 scores to be able to actually calculate the measure, but we also feel pretty strongly that unless we actually push to make it happen, the infrastructure changes that are needed to get that done are never going to happen. So we continue to be pro DRRE.
Great. Thank you so much for that feedback, Dr. Schultz. And looking here again at the chat, Zandria shared with us about how considerations for creating decertification criteria, performance basements, rather than achieving the benchmark, having that be a part of it, and then a multi-year corrective action process. Thank you very much for that thoughtful feedback, and we agree these would all be, important things to build into that process. Yes, and thank you also seeing here, Zach. Yes, you are most welcome. This is, exactly what this meeting is for, to give you early insight into what we are thinking so that we can get your feedback, and anything we implement down the road, we can make sure that we do in a thoughtful and collaborative way. Any other thoughts before we close out the meeting? Okay, Amarani. Oh, Sandra.
Kristen, you had shared a couple times about best practices that you guys may see in certain areas. And I just wanted to highlight that as I think as another opportunity, especially in measures that all plans are focused on, like say cervical cancer screening. Like if there was a forum for the plans who are on the exchange to share, best practices, new innovations, intervention, like anything that folks are working on to drive performance that could potentially be implemented by others to kind of help us all as a community be moving in a positive direction. So I think I think we would be open to that, and that might be another benefit of having this group and kind of a shared population, is being able to share best practices amongst ourselves, as well as from there's so many great resources out there who consolidate some of the best evidence around interventions that we might consider.
Thank you so much, Sandria. And I agree. And not to get into thinking about like logistics and what meeting would we share this, but yes, we are certainly interested and think that it would be wonderful for carriers who had successes in some areas to share with your peers. And we're happy to convene. So more to come there, and don't be surprised if we follow up with you with that offer. All right, let's go ahead and move to the next slide. Okay, and this is really just here about next steps in the quality program for this year. As you know, the QRS star ratings, the preview period is, I think, starting in about a week and a half. And so these are going to be the star ratings that customers see when they go shop for plan year 2026. And all of the carrier QISs are in progress. I'm in the process of reviewing those and giving feedback. And then, like we talked about, November is the meeting where we discuss, specific results. And it really is, the results that we see from the QRS and QIS. And then, these types of conversations and meetings that we take all of this together. And that really helps inform the changes to the quality program that we propose in December. And those are, the big ones are put in through our guidance for participation. So those are some next upcoming steps. Any other questions before we close out today? All right, well, we just want to thank you all for your thoughtful engagement and participation today. This was a really great meeting. Have a great afternoon, everyone. And thank you for the time today.
Thanks all.
Thank you.
Thank you.
Thanks.
Thanks.
Bye.